Are you tired of being asked why you look upset all the time, even when you're having a great day? Let's talk about what causes the frowny look of the mouth and how to turn that frown upside down. Some signs of aging are very obvious, such as your hair turning more gray, wrinkles on the face, and sagginess forming in your neck. Other signs of aging, such as the mouth corners turning down, are less obvious early on. What are the signs of aging for the mouth area, or as we call it technically, the perioral area? The perioral signs of aging are wrinkles of the upper cutaneous lip, an elongated philtrum and less defined philtral columns, a thinner upper lip, and a loss of the Cupid's bow definition, downturned lip corners or the oral commissures, pronounced nasolabial folds, pronounced marionette lines, and enhanced asymmetries that present more as we age. Let's drill into the downturned lip corners and see what causes this type of phenomenon. For one, you have the hyperactivity of the DAO muscles. DAO stands for the depressor anguli oris, which originates from the mandible and inserts into the angle of the mouth. This depresses the corner of the mouth. Another cause is volume loss. This is associated with global facial fat atrophy. Third, we have the lateral red lip that can get turned in. And the fourth is, of course, gravity. Over time, gravity takes its hold on the face and brings everything down. And this is all enhanced by the cheek mass turning in and moving down, making the marionette line stand out even more, and that in turn makes the frown look worse. So what are the possible treatment options for the perioral area? Let's start with non-surgical options. For one, we have filler. This can be an HA or hyaluronic acid filler. It can be fat. It can also be Sculptra. Possible injection locations include wrinkles of the upper cutaneous lip. This is not my favorite place to inject due to migration of filler that can occur and the possible Tyndall effect, where you start to see this bluish hue that's occurring in the area of injection. Another area to inject is, of course, the red lip itself. This can be injected on the part that you actually see, which is the dry area, or it can be on the wet part of the lip that's more on the inside of the upper lip or the bottom lip. You can also inject into the oral commissure. These injections are usually a combination of the red lip as well as the cutaneous lip around it. And lastly, of course, you have injections into the nasolabial folds and the marionette lines. Examples of popular fillers that are used include Restylane L and Restylane Silk. These are basically either low G' or medium G' fillers that can be used to soften these lines. Potential problems with fillers include nodules, migration, infection, and of course vascular occlusion, which is the most risky. Vascular occlusion is when filler can get inside of an important blood vessel, which can in turn lead to tissue death or even something like blindness. Filler, especially around the mouth area, usually lasts for 3 months to about 9 months on average. Another non-surgical treatment for the mouth area is neurotoxins such as Botox. A potential area to inject is the DAO muscle that we talked about previously. Usually 2 to 5 units are injected per side, and you can inject about 1 centimeter lateral and down from the corner of the mouth or more along the actual mandible, which is the lower jaw. You need to be careful not to hit the DLI muscle, which lives next door to the DAO muscle. Hitting this muscle can cause significant lip dysfunction, and neurotoxins will usually last about 3 to 6 months, depending on the exact product used and depending on the patient's own metabolism. Other non-surgical options to combat the aging process of the mouth area include laser resurfacing. This is usually done with lasers such as CO2 or erbium YAG to allow some of the outer layers of the skin to rejuvenate and to give you fresher looking skin with fewer fine wrinkles. Another way to do this is with chemical peels. Keep in mind that the deeper types of chemical peels usually work best for the perioral area, since the wrinkles that we have on especially the upper lip can be a bit stubborn when it comes to refreshing the area and removing some of those fine lines. Another option is radiofrequency energy with or without microneedling. And lastly, you have thread lifting, which can sometimes help, but usually this provides a very temporary solution. But some people would prefer a non-surgical option, such as threads, over a more invasive procedure. Some threads are meant to actually lift and maybe soften the nasolabial folds, for example, or the marionette lines, and other types of threads are meant to just build up some collagen to strengthen the area. Now let's get into some of the surgical options for rejuvenating the perioral area, especially with addressing the downturned corners of the mouth. First, we have to talk about facelift surgery, and we have a separate video where I went into detail about the various techniques used for facelifting, so make sure to check that out if you want to learn more. But a deep plane facelift with full ligament release can sometimes help with some of the perioral areas. For example, it can improve the appearance of the nasolabial fold and the marionette lines if the dissection is performed medial enough. But it may not have as much impact on the actual oral commissure, especially if volume loss is the main reason for the depression and the downward trajectory that is sometimes seen in that area. And some of the risks associated with facelift surgery include bleeding, infection, nerve injury, and early aesthetic relapse, which means that the effects of the facelift may not last as long as one would hope. And when people ask how long does a facelift last, I would say that it's a very wide range. It could be anywhere from 3 months up to 10 years plus. It depends on technique, and it also depends on the person's actual tissues and how they change over time. Another surgical technique to rejuvenate the mouth area is a lip lift procedure. The most common technique for performing lip lift surgery is a bullhorn style technique. My personal version of it is called the Ella lift surgery, but it's still a bullhorn style lip lift. A lip lift shortens the philtrum, it increases the arch of the upper lip, it also increases upper lip volume, and it can potentially increase your upper tooth show when you smile, and sometimes even when you part your lips. Some of the risks of a lip lift surgery include pore scarring, infection, speech change if the underlying muscle is manipulated, and it can sometimes make a frown look potentially worse. I find this is the case in some patients when they have limited upper red lip show as you extend out to the lateral element of the lip or the oral commissure. Those patients are at higher risk for a little bit more of a frowny appearance post lip lift. Here's an example of one of my patients who had a lip lift performed elsewhere, and you can see that the result is that she has quite a bit of that central arching, because with a lip lift, generally the area under the nose is what actually lifts. So if you have downturned lateral red lip, you might get this almost bell-shaped type of appearance. And so she came to me looking for a way to improve her situation, and she didn't like that significant arch that she was left with after her lip lift performed again at another clinic. So what we did for her was actually a corner lip lift, and we'll talk about that in a minute, to improve the overall aesthetic of her upper lip. You can see now that she has a much smoother contour of her upper vermilion border as you follow it from the oral commissure across the Cupid's bow area over to the other oral commissure. A corner lip lift is yet another surgical way to improve the mouth area and to potentially rejuvenate it. Some people call it a grin lift. With a grin lift, a triangular excision is extended far lateral. This results in a scar that can resemble more of a Joker type of look and can be harder to hide. It might be useful in more extreme cases, but I do tend to avoid this far lateral extension to the incision, because if the person doesn't heal well, those lateral incisions and those scars tend to be quite prominent and very difficult to hide. My approach to a corner lip lift, and what I did for that patient I showed you, is to address the rolled in aspect of the upper red lip. Now, this is helpful if the frowny appearance has to do with that lateral upper red lip being rolled in. But if instead the problem is that the actual commissure is droopy or it lacks volume, then surely you need more than just a corner lip lift. The nice thing about the way that I perform the corner lip lift is that the actual scars are hidden along the vermilion border. So I create this little triangular excision in a way that the scars are quite hidden and there's no extension beyond the oral commissure. This surgery works great for the right candidate. Keep in mind find that a lip lift can be performed at the same time as a corner lip lift, though my personal preference is to do a lip lift first if the patient is a candidate for a lip lift, and then later consider a corner lip lift. And this is for three main reasons. For one, many patients don't end up needing a corner lip lift. I get asked that a lot during a consultation. Do you think I'll need a corner lip lift? Can you do it at the same time? I say, let's wait. Let's do the regular bullhorn style lip lift. In my clinic, that's the L lift. And let's see if you even need a corner lift later on. Most do not. Another reason why I like to do the bullhorn style lip lift before a corner lip lift is that I like to see how someone heals, because it's much easier to hide the incision at the base of the nose, even if the scarring is a bit more obvious than a patient may have wanted, than it is to hide a scar that's more in a prominent location, such as along the vermilion border. So for example, if someone doesn't heal well from a bullhorn style lift where the incision is right here, then I would rather not proceed to a corner lip lift. So I'm looking for a good candidate for a corner lift based on the overall anatomy, how much rolled in upper lip is there on the lateral aspect of their lip, but also, are they a good healer? Can they potentially go through this type of surgery and heal overall quite well? Because it's hard to really treat that type of scar that's right along the vermilion border. Your treatment options become a bit more limited. Another reason why I like to do the lip lift first before the corner lift is because I find that if you're doing them all together, there's a little bit of guesswork that goes into how much of this lateral lip do you need to remove to make everything look as ideal as it can. It's much easier to determine the amount of excision out here on the side after the lip lift result has settled. And when you're working in the middle of the face, you need to be super accurate with your measurements and of course with the actual surgery. There shouldn't be any room for guessing. Now you know how a frowny mouth forms and ways to improve it with and without surgery. Remember that in many instances, multiple modalities may be needed, especially because often there are other aging changes at play that can often be addressed at the same time.